Hi everyone. In this clip, I will talk a little bit about polycystic ovary syndrome or PCOS. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health related matters, please ensure to consult your healthcare provider. So, first of all, we have PCO and PCOS. And even though they may sound similar, they are distinct conditions with different impacts on the body. Polycystic ovaries, or PCO, typically refer to a physical characteristic of the ovaries, where a multiple small follicles are visible on an ultrasound. Individuals with PCO usually don't experience symptoms beyond that, and their hormone levels are generally actually within normal range, and diagnosis of PCO is often actually incidental, meaning it is discovered during a routine scan or fertility assessment, but it doesn't typically lead to further medical intervention. Polycystic ovary syndrome, or PCOS, however, is a more complex condition involving a broader range of symptoms and hormonal imbalance. Along with the presence of multiple follicles in the ovaries, PCOS is associated with irregular menstrual cycles, signs of excess androgen, such as increased facial or body hair, and sometimes difficulties in weight management. Diagnosing PCOS requires meeting specific criteria, usually involving at least two of the following: is either irregular or absent periods, high androgen levels, or the polycystic ovaries. So PCOS affects women of reproductive age. It can cause irregular periods, excess body hair, including on the chest, stomach, and the back, acne or oily skin, male pattern baldness, or thinning hair, weight gain, especially around the belly, small pieces of excess skin on the neck or armpits, which are called skin tags. All of that can happen. So it, of course, comes with some other health risks, such as, for example, increased risk of type 2 diabetes, heart disease, high blood pressure, high cholesterol, sleep apnea, and so on. Conventional treatment for this usually is around lifestyle changes, such as weight loss and eating a healthy diet, medications to treat some of the symptoms, such as excessive hair growth or irregular periods and fertility problems. They can even do laparoscopic ovarian drilling, or LOD, which is a surgical procedure that destroys the tissue in the ovaries that produce androgens. So ovaries normally produce some male hormones called androgens, but women with PCOS make too much. Excess androgen interferes with ovulation and can cause infertility. Each cycle, we have a follicle that's supposed to break open and release a mature egg. So in women with PCOS, that doesn't happen. Instead, the follicle sticks around as a tiny cyst. So here's where it gets tricky. The cysts themselves produce androgen. So it's not clear if they are what causing the PCOS, or if they are the result of having too much androgen to begin with. It's sort of like a chicken or egg thing. So more likely, your doctor will initially start testing for PCOS, perhaps with blood tests to measure hormone levels, because of other telltale symptoms like irregular periods, excess hair growth, or acne, and so on. Because those symptoms aren't exactly debilitating to your health, you may feel that you may feel like they're not worth mentioning to your doctor, but don't brush them off. Part of the problem is that there is no one test used to definitively sort of diagnose PCOS. It's considered a diagnosis of exclusion, meaning a doctor will determine that you have it by ruling out other conditions that can mimic it. To further complicate matters, PCOS symptoms run the gamut of medical specialists. A dermatologist may treat you for acne, but may not ask about your menstrual cycle. Your gynecologist may know about your irregular periods, but may not take note of the body hair. So you have a number of healthcare professionals who can potentially treat this condition, but each one looks at it sort of from their own perspective. So be sure to mention all the symptoms, even if your doctor is primarily focused on one of them for the best treatment. So when it comes to the orthomolecular medicine side of PCOS, this is a complex hormonal disorder, and there isn't a one-size-fits-all type of cure. But main steps to address this issue will include things like first, dealing with any insulin resistance. Many individuals with PCOS experience insulin resistance, where their cells actually don't respond effectively to insulin. This can lead to higher blood sugar levels and increased androgen production. Certain nutrients also may play a role in improving insulin sensitivity, such as, let's say, inositol. Specifically two different types are there: myoinositol or dechirioinositol, or both. These are isomers of a sugar alcohol that has shown promise in improving insulin sensitivity, regulating menstrual cycles, and improving ovulation in some women with PCOS. And both are available in capsule form. Then we have chromium. This trace mineral is involved in glucose metabolism and may help improve insulin sensitivity. We have magnesium, which is involved in numerous metabolic processes, including insulin signaling. I do have a clip or two on how to deal with insulin resistance in general, if you're interested. I have posted them, I believe, a few months back, and you can view them if you wish. To deal with hormonal imbalances, you would need vitamin D3 and K2, which can be helpful. And deficiency in this nutrient actually is very common in women with PCOS, and supplementation can be beneficial in at least like 5,000 international units a day. Omega-3 fatty acids are another good thing. These are essential fats that have anti-inflammatory properties and can help regulate hormone production. Then there is N-acetylcysteine, or NAC, which is an antioxidant that can help lower androgen levels and improve the insulin sensitivity. Chronic low-grade inflammation is increasingly recognized as a factor in PCOS. Certain nutrients with anti-inflammatory properties might be quite beneficial, such as omega-3 fatty acids, curcumin, which comes from turmeric, vitamin E, B vitamins, and zinc. The treatment for this is highly individualized and based on person's specific symptoms, lab results, including nutrient levels, hormone levels, insulin markers, and overall health status. One age-old remedy that has helped many of these PCOS patients is the application of poke root and castor oil. Now, this remedy helps prevent the growth of cysts. It decreases the size of cysts. It decreases inflammation. It promotes metabolic balance and hormone regulation. So a poke castor oil pack involves the use of cloth soaked in poking castor oil. It is usually placed on the skin and covered with a sheet of plastic. Then a bottle of hot water is placed over the pack so it gets properly absorbed into your skin. Now, here are some things you will need when using poking castor oil for PCOS symptoms. One, you need organic castor oil without hexanes. You need cotton flannel or wool wide enough to cover the pelvic area and abdomen. You need a container with lid. You need a hot water bottle. You need a towel to prevent staining of the bedding or the couch that you'll be lying on. So what you do next is that you place the flannel or wool in the container and you soak it with castor oil, the poking castor oil, and ensure that it's saturated but it's not dripping. Okay, so now you place the pack over the pelvic and the abdomen area, cover it with another layer of flannel or saran wrap on top, and place the bottle of hot water over the pack or even heated pad or blanket or whatever you have. Now leave it there for about 45 to 60 minutes. Take a good rest while the pack is in place. You can use this time to meditate or even like take a nap. And once you remove the pack, properly clean up the area with baking soda diluted in water and rinse it. When you're done, store the pack in the refrigerator or in a covered area. It should be stored in a cool area. You can reuse this up to 25 to 30 times. And if you feel there is not enough oil, just add oil to it every time. So for greater results, ensure to apply the pack on a regular basis, at least like 4 consecutive days every week for about 4 to 6 weeks in stretch. So keep in mind that using it daily will provide you with the most beneficial results. Try making the castor poke combination yourself to ensure the quality and the potency. The wrap kit and the poking castor oil probably will run you around $115, but it's well worth the price. The foods that are helpful is consume cruciferous vegetables like kale, collards, cabbage, Brussels sprouts, cauliflower, if you don't have any thyroid issues. Avoid soy because it's rich in estrogens. Eat fermented foods like kimchi or sauerkraut. Consume more fiber-filled foods, and because it could sort of help digestive system and liver eliminate excess estrogen. Avoid microwaving food in plastic. Aim for organic foods. And these are the few things that you can follow. So now from the metaphysical side of things, PCOS can be linked to wounds to the feminine self. If there's a deep sense of insecurity, discomfort with one's femininity, or negative societal views about women and their cycles, right? There's also energetic blockages. These are imbalances or blockages in the body's energy flow, particularly in the pelvic region, and that can manifest as PCOS. Unprocessed grief or trauma, unresolved emotional pain, especially related to loss, can be held in the womb space and contribute to physical symptoms. Disconnect from cyclical nature, potential disconnect from the natural rhythms and energy shifts of the menstrual cycle, possibly due to societal pressure to conform to a linear masculine way of being. If you're living with PCOS, addressing your emotional and mental health is an integral part of overall well-being. Seeking support from therapists, support groups, and practicing self-care can be quite beneficial. Hope this has been helpful. Like and follow for more. Be the light.